from either side in 100 yards on nose running. Roger, bringing next to the door. Checking his equipment. Running in now, just descending now. Roger, running in now. Communication. Pointing.
Rough handling can kill an immersion victim, particularly someone suffering from hypothermia. So it's important to get things right from the start. In the water, there's greater pressure on the legs than on the chest. This pressure, called hydrostatic squeeze, actually helps the body's weakened circulation, in particular the return of blood from the limbs to the heart.
Oh, we've had the thumbs up. Winch again.
A vertical rescue brings at least two potentially fatal factors into play. First of all, the victim suddenly loses the benefit of hydrostatic squeeze. Second, gravitational forces actually pull the blood down into the legs. When someone is suffering from hypothermia, their circulation may collapse, with fatal consequences.
Clear of the water. And you clear forward.
Because of this danger, called post-rescue collapse, vertical helicopter lifts are not the ideal choice for hypothermic victims, although necessary when speed is required.
By the door. Give me the survivor report.
If they have to be used, rescue teams must be aware that the victim's condition may have deteriorated considerably during the lift. Casualties must be laid down immediately on board. Make sure the legs are kept slightly higher than the head to help circulation to the heart. Remember to take into account the likely tilt of the helicopter's nose during flight. This particular lift, using a double strop, is being used successfully by the Coast Guard at Lyon Solent.
Steady.
Although a little slower than a single strop technique, the hypothermic victim can be lifted in a reclining position. The stress on the heart is now minimized, while the lift itself is far more comfortable. By far the best method of recovery is to get the casualty into a horizontal position straight away. Inflatables are ideal. Once again, position the feet slightly higher than the chest. It's best to place the head to the stern of the boat, as the bow will inevitably rise when underway. If returning to a ship, the casualty should remain in the seaboat until it's been hoisted to deck level or inboard. Don't allow anyone who's been in the water for some time to wander around or even sit up for at least 30 minutes after rescue, as they may still suffer a fatal collapse. Emotionally, there's often a delayed reaction to the events that have taken place.
The wind got up to sort of easterly, southeasterly, quite brisk, with quite a swell down off St Catherine's. They were wet, semi-hypothermic when they were picked up, and in shock. They were totally exhausted. They stuck it out until such a time as we actually got to them, which was quite a long trip because of the distance. But as soon as we got there, the reaction was to be violently ill and totally be out of it, if you like. Having stuck it so long, people's resolve and instinct for survival is obviously strong enough to make them wait until someone arrives, and when someone arrives, the pressure release valve takes over and it all comes out.